During the war, there were 3 different types of poison gas that were mainly used: chlorine, mustard gas, and phosgene. Each poison gas had different effects, but most of them had the potential to cause death in some manner and could be spread through the air as vapor or in water. Effects of chlorine gas caused people to have nausea, chest pain, headaches, and hemoptysis, which is just fancy talk for coughing up blood in the lungs. Chlorine was a gas mainly used by Germany, who used it to attack Britain and France. Mustard gas and phosgene, on the other hand, were used mainly by Britain and France. Effects of phosgene were burning in the throat or eyes, vomiting, burns, and pulmonary edema, or liquid in the lungs. The effects of mustard gas, which was the only gas which was not entirely lethal, included tearing in the eyes, swelling, itchy, blistering yellow skin, third-degree burns, permanent blindness, melted organs, and respiratory cancer. It is estimated that as many as 85% of the 91,000 gas deaths in World War I were a result of phosgene, but the most commonly used gas was mustard gas.
When looking at the creation of poisonous gas, a German scientist, Fritz Haber, developed a new weapon alongside a team of chemists. The research was sparked by the World War itself. However, small amounts of poisonous gas, such as tear gas, had been used earlier in other countries. Chlorine gas, on the other hand, was developed to be lethal. This gas, as mentioned earlier, caused severe consequences, specifically to the respiratory tract. This was a revolutionary discovery, and the effectiveness of this was to be tested in the Second Battle of Ypres. With the use of the newfound technology, German forces shocked Allied forces along the Western Front by firing more than 150 tons of lethal chlorine gas against the 2 French divisions in Belgium. This was the first major gas attack by the Germans, and it devastated the Allies. These shells of gas were unheard of before, and many changed aspects of the war.
Because of trench warfare, the war was a stalemate and neither side was allowed to advance, which urged the countries involved to develop new technology. Germany's creation and demonstration of how effective chemical weapons were against trench warfare can be seen in the Second Battle of Ypres on April 22, 1915, when they tested chlorine gas. Another advancement in poison gas was the development of phosgene. This was tested on December 19, 1915, when Germany used this to attack Britain. However, phosgene soon became the primary chemical weapon of the Allies. Another creation was mustard gas, in which the effectiveness was tested by Germany against British and Canadian forces at Ypres on July 12 and 13, 1917, in order to disable the troops rather than kill them. This was then later used against France's Second Army. What made these poisonous gases so dangerous was the large area of effect it had and the lack of gas mask provided.
As seen from the effects of the gas itself, it's very clear that it was very deadly in the short term, but long term as well. It severely impacted many troops and killed thousands. It's estimated that 100,000 tons of chemical agents were used, injuring a suspected 500,000 troops. As stated before, the Germans were the ones who began the race to develop chemical weapons after firing chlorine gas at the Battle of Ypres. The French fleet that it was fired on faced devastation, decreasing morale, ending with Germany having an advantage early on in the war. The German advantage, however, was closed rather quickly as the Allied forces adopted these strategies and started to develop their own chemical weapons. The production of poisonous gases led to countries creating preventative measures. For example, the invention of an activated charcoal mask in Russia, which was created in 1915 by Nikolai Zelinsky, only came into use at the end of the war in 1918. Following the end of the war, the millions of casualties and the tens and thousands of deaths due to chemical weapons ultimately led to public outrage, ending with the Geneva Protocol prohibiting the use of chemical weapons in warfare, which was signed in 1925.